let's get started. I know I just wanted to give a little preface as we get into this module. I know the last two have been really heavy on the sequencing and phylogenomics. This is going to presentation is going to step back a little bit to talk more generally about the importance and role of environmental surveillance using wastewater in particular as a tool for public health. Um, with the subsequent talks in this module, we'll get more into the sequencing and molecular analysis, a little bit heavier. So this is going to be a broad overview, and then we'll narrow down as we go through the talks. All right, so let me just start with something that you all know working in the public health field. Like, what are we saying when we're talking about public health surveillance? So the classical definition is the ongoing systematic collection, analysis, and interpretation of health-related data essential to planning, implementation, and evaluation of public health practice. And this has really traditionally been, at the level of an individual seeking treatment, seeking healthcare, being screened. It's very much an individual level that then moves to the population. Um, when we're talking about wastewater surveillance and environmental surveillance, it's really about how environmental testing can support and improve surveillance for public health. We have the ability to really see a lot of what's happening in our environment around us, including the diseases that we may be dealing with. It's sort of like a health fingerprint that we leave in the environment. So this can be anything from using DNA and RNA, which is primarily what we do, but it can be looking for particular bacterial pathogens, viral pathogens, pharmaceuticals, any other, many other types of markers can be used in environmental testing. When we talk about what environments those are, that can be a wide range of things. It can be used in different types of water sources. It can be used anything that, somebody may touch. It can be our built environment. And then, of course, our toilets and wastewater is the highlight today, which is really proven to be a very potentially attractive means of looking at a lot of different diseases for surveillance. So this was from a magazine graphic. I think it was The Guardian early on in the COVID-19 pandemic, where we really started seeing the value of using wastewater to tell at a population level what may be happening in terms of disease trends. But it's not specifically where this started, it's just really where it took off. So let me back up just a minute and talk about wastewater. So typically we think of wastewater as, what we're getting rid of. It's all about treating it, making sure that it's safe to go back into the environment, to have a healthy ecosystem. But it also has a lot of information and a lot of materials that are part of that wastewater stream. So if we look at the USGS definition, wastewater is simply used water. It's the substances such as human waste, food scraps, oils, soaps, chemicals. It comes from homes. It could be the water in your sink, shower, what comes off of your skin, bathtub, the toilets, washing machines, dishwashers. It also includes anything that businesses and industries may be contributing as well. So it's a really broad milieu of pretty much our human footprint in the environment that makes its way to a wastewater treatment plant. One of the way that those of us working in the field like to think about it is it's really an information highway. So we've gone from just thinking about wastewater as something we need to treat and move on from, which is clearly extremely important, but also as a way to tell what's happening across a population. It's been used for a long time to look at pharmaceutical use across a population, illicit drugs, dietary supplements in some cases, what's going on in terms of what people are eating and using. Are we seeing a spike in caffeine, maybe cortisol levels for stress? Some relatively novel work has even been able to look more broadly at health. You can look at signatures of obesity and antimicrobial resistance and other pharmaceuticals as well. So there's been a broad history of using wastewater to tell us information about a population. The idea of sort of tracking what's happening in a city with sort of the moniker of wastewater-based epidemiology or wastewater surveillance really started growing in the 2000s. This was a paper that was really looking at chemical use. So to monitor the health of cities' residents, look no further than their sewers. And the idea here was to look at drugs and other compounds that communities were consuming. And there has been a lot of efforts to use this in the opioid epidemic. This group with Rolf Halden at Arizona State University really started pushing ahead on this idea. If you're at the mouth of a wastewater treatment plant, you can essentially observe all the chemistry that's being used in the city. Of course, it's more than just the chemistry, but that's been where a lot of the attention has been paid. And when you look back at when the first idea of sewage epidemiology, wastewater-based epidemiology, it was really based in this idea of looking at drug abuse and opioids. So the first use that I have found of this terminology, sewage epidemiology, was in 2008. And since then, it's really taken off. But the idea of using sewage to track what's happening in a population has been around for a lot longer than that. It's just become more formalized. You can go back to the 1940s, where Brendan Moore was using swabs in wastewater streams to try to identify carriers of Salmonella typhi in England. You can go back into the 1940s and 50s. People were using sewage to look at poliovirus. That has continued through the 2000s to evaluate vaccine campaigns. So the idea that we can find pathogenic agents in sewage is really not new. I think many of us who worked in this back in the day, if we needed a positive control of hepatitis A virus, it was a lot easier just to go down to our wastewater treatment plant, get a sample, and pull it from there. So we know that we can detect these things, and we've known we can detect infectious agents in sewage for a very long time. The difference in where we're moving now is we're doing it on a more systematic basis. It's not just a one-off. It's become an important tool in looking at what's happening over a broad community. So in 2018, Choi published a paper that was really looking at the past and the future of wastewater-based epidemiology. It kind of ignores some of the past biological use that I just mentioned and really focuses on how it has been used as a chemical marker. So pharmaceuticals and personal care products were some of the original use, industrial chemicals, population markers. And in 2018, the idea was the future was going to be biologicals. And in that, I think, pathogens, antibiotic resistance genes. The future really came to a head in 2020 with the COVID-19 pandemic. So if you just do a Google Scholar search, so this was just looking at search terms using sewage-based epidemiology, wastewater-based epidemiology, sewage epidemiology, sewage-based epidemiology, you can see this inflection happens quite dramatically between 2019 and 2020. This is really when the idea of using wastewater as a surveillance tool for infectious agents really took off. And of course, we know what happened then. That was the beginning of the COVID-19 pandemic. Sort of the seminal paper on this was published by a really broad group of lots of researchers doing a really important and fundamental work in this area. And this was published in Environmental Science and Technology very early in the pandemic, where it was becoming clear that we could find the SARS-CoV-2 virus in wastewater. It could be found relatively reliably. This was when there was a lot of panic and worry about how we were going to get how many people tested, and wastewater quickly became it became quite clear that you could look at a broad swath of the community in one single sample and have an idea of what was going on. So if I can step back from COVID-19, I'm going to touch on that a lot in this talk just because that's where the bulk of the work has been, but it's not solely related to COVID-19. The idea of using wastewater-based surveillance to look at disease trends really could be for any number of pathogens that are shed in the feces or urine, or even those agents that may be washed from the skin that can then be detected in wastewater and tracked for infection trends. So when you're thinking about criteria of what would be useful to look at in terms of wastewater surveillance, the first thing is, can you actually find it in sewage in a reliable way? Even if you don't know exactly how it's getting there, are you finding it there? Can you find it in concentrations that are sufficiently high that you can detect it with relative ease? And do you have specific detection methods to identify it? Places where this has either been used, at least on a small scale, or the utility has been proven, things like hepatitis E virus, norovirus, adenoviruses. It's also been used, again, for polioviruses and and successfully in the last couple of years as seeing some new cases of poliovirus pop up in unexpected areas. Interestingly, you can also detect some vector-borne viruses, including Zika, West Nile. and of course, respiratory viruses, influenza viruses, coronaviruses, RSV. In addition, we can also use it to look for any number of antimicrobial resistance genes. I'm sure this list will grow as people start trying to understand what you can find in wastewater. But it's a tool that really goes beyond just what your enterics that you might think of as being shed in feces to a broad array of potential pathogens. So when we talk about wastewater-based surveillance or wastewater-based epidemiology, this is just kind of a graphic to show, what we're looking for. Again, we can find lots of things: prescriptions, at least illicit drugs, uh, diet, you know, consumption patterns, infectious agents. And when you look at what's happening in a wastewater treatment plant, you can sort of think of it in a couple of levels. And one way to look at it is in this little inset on the left here is, these are the lines that come into a trunk line that will then eventually reach a wastewater treatment plant. Each of those lines eventually goes to somebody's house. When they all come together in a trunk line and eventually end up at a wastewater treatment plant, you're looking collectively at, sometimes as few as maybe 100 homes or buildings, and sometimes it will be representative of 1 million or more. So it can be a very broad cross section of your community. When you look at that a little inset, you'll see it kind of has the contours of looking at a river system. So we think about, a watershed when we think about rivers and all those tributaries that lead into that larger stream. When we look at a sewage conveyance, we're looking at a sewer shed. So the idea is it's capturing all these little tributaries or individual homes and businesses, and then eventually going into a trunk line and then reaching the wastewater treatment plant. So one of the advantages of this, of looking at the plant level, is you're not looking at any individual person. You're not violating any specific privacy. You're really looking at an anonymous way of evaluating what's happening over a broad swath of the community. It can also be flexible. Sometimes you can go up the trunk line a little bit to get a little bit, maybe to get into a neighborhood. So you're still not necessarily getting into individuals, but if you need to know where a hot spot is, you've got the ability to sort of move up this catchment, this sewer shed, to try to identify what might be going on. So when we talk about wastewater surveillance broadly, it's non-invasive, so people don't have to show up to get tested for anything. If they're using water in an area that's served by a wastewater treatment system and catchment area, that sample will be taken. So it maintains privacy, especially at these broad areas, so you don't need an IRB to do this work. It gives you population level data without extensive clinical testing, although as I'll go through later, it's certainly nice to have both of those things working together. The data can be near real time. You can collect a sample, and if you've got the feasibility in your lab, you can process it within hours. So you've got the ability to really get a true snapshot in time at a near real time basis. It can give you spatial trends. So again, if you've got multiple plants that you're working with, or you've got the ability to go up some of these conveyance or trunk lines, it can give you an idea of what's happening at neighborhood levels. And temporal trends. The idea is these things are set up and you're taking samples, sometimes daily, sometimes twice a week, sometimes once a week, but you've got a way to look at what's happening over time. So it's providing a really powerful level of surveillance. So I'm going to back up a little bit now. So that's sort of the general overview of what wastewater surveillance looks like, and I want to sort of back up to what we think of as traditional surveillance practices in public health, and how incorporating environmental or wastewater-based testing into it can improve or at least augment those methods. So if you look at the typical types of public health surveillance, we've got our passive surveillance. So this is diseases are reported by healthcare providers. The idea is it's relatively simple and expensive. You might have some incompleteness of data, variability of quality, because this is just being passively moved to up the chain in terms of our public health agencies. Active surveillance, as you know, this is health agencies are contacting health providers. They're seeking out reports. You're going to get more data. And it's usually used in conjunction with some specific epidemiological investigation and not necessarily happening all the time everywhere. Sentinel surveillance, this is your reporting that's based on some geographic area or a specific reporting group. So this can fall into either passive or active surveillance. And then syndromic surveillance, where you're really looking at symptoms. So I want to focus specifically on passive and sentinel surveillance because this is really where wastewater and environmental surveillance fits in terms of the overall public health surveillance matrix. So if you look at wastewater surveillance, it really falls into this idea of a passive surveillance. You're getting a pooled community sample captured in wastewater influent. So instead of being reported by healthcare providers, it's essentially being reported by the lab that's processing the samples. Pathogens are screened regularly across broad geographic areas. So when these systems are set up, you're getting samples on a very routine basis, and it's usually from many different communities that are using wastewater that have wastewater systems. So if you look at the CDC National Wastewater Surveillance System, we've got a national view of what's happening in terms of specific agents. Again, it can be near real time. If you have the capacity, these samples can be processed almost immediately. Um, it's not always done. Sometimes as we get into, we're trying to accommodate more and more labs across a broader geographic area. Sometimes the delay can be a little bit more, but depending on your needs, it could be near real time. And again, it avoids specimen collection and treatment seeking. It is just, people are just using their homes, and the water is going to a wastewater treatment plant, so you're getting that sample anyway. It also falls under the heading of sentinel surveillance as well, because you can focus on a smaller community, you can focus on a sub sewer shed, you can also focus in alternate areas. Wastewater-based surveillance isn't always just what's happening at the plant or in a sewer line. It could be at a port of entry, think cruise ships. It could be in airplane waste. You can also use it in animal facilities as well if you're interested in spillover events. So it's got the capacity to both act in a passive surveillance manner as well as a sentinel surveillance manner. So if we just go through sort of like what you would expect surveillance steps to be and how wastewater fits into here. So the first thing you're going to need is your data collection. The data need to be analyzed and interpreted, disseminated, and then this last one is the link to action. And that's really the critical step that I think it's important to have these conversations with people that are doing all of the, these data collection and analysis on the top, and what that means in terms of how we're linking that to public health action. So let me just walk through each of these, and I'll use some examples from things that we've done in Athens, Georgia, and some examples more broadly. But we start with data collection. So this is, where does the sample come from? So it starts with sample collection and analysis. So these are examples, whether it's at the wastewater treatment plant. So every wastewater treatment plant has a headworks. Plant operators have to take samples of that influent for their plant operations and maintenance. So it's a relatively easy place to get a subsample if you're interested in doing that. I know some labs are also using wastewater solids, again, at this influent point. The idea is you're getting that sample as it's coming into the plant. It is the most representative that it can be of the community when it gets there. You have to make decisions about how you're collecting that sample. It could be a grab sample, so literally you go in with your sample. The treatment plant operator, takes a 1 liter bottle and hands it off. More often, though, it's a composite sample, and this is again another advantage of doing this wastewater surveillance. So generally, at these headworks, the way that the influent sample is collected, they often have automated samplers set up that are set up generally on a time composite. So basically, it's going to take a subsample every 10 minutes, every hour, however it's set up, so that by the end of a 24-hour period, you have a composite sample to work with. So you've got something that's representative of a full day of sample coming in. And that's really important when you start thinking about how people, you know, people's habits when it comes to water. Um, in the morning, we have a lot of showers. There's a lot of water use. In the evenings, we have a lot of water use. So you've got sort of ebbs and flows. And by taking a 24-hour composite, it really lets you look what's happening over the entire day, so you don't miss something. So you have to make those decisions, composite versus grab. You need to make a decision about your catchment. So again, usually it's at the point of the wastewater treatment plant. Sometimes, as you can see in the middle figure here, you're going into the sewer shed itself and you're taking a sample at a manhole. And then your timing. So again, with surveillance, you want to be able to have regular intervals that you're collecting sample. This is not, It's not as helpful to do it as a one and done. You want to be able to take samples on a regular basis. Oftentimes, I think the sweet spot has been 2 to 3 samples a week. One sample a week still gives you a lot of information. Some places with capacity have done daily. So just to give you an idea of what a sewer shed looks like, I'll give you Athens, Clarke County, which is where we are in UGA. So the entire county has a population of about 127,000 people. We have 3 water reclamation facilities. So we've listed those as catchment area A, B, and C. They have different sizes. So catchment area A is our largest. It generally takes in about 5.3 million gallons of sewage per day. This includes the area includes University of Georgia, downtown Athens, and some industry in the northern part of Athens. Our catchment area B is a little bit smaller. It takes in on average 4.8 million gallons of sewage a day. This is an interesting catchment because it includes our only 2 hospitals in the region. And then catchment area C is our little one. This is 1.6 million gallons per day, and this is almost entirely residential. So one of the advantages of being able to sample from each of these plants is that they have a little bit, their character's a little bit different. The population that we're getting in catchment area A is a little bit different than B, which is a little bit different than C. So we had in our process with this, we had sampled all of them, but that's not always necessarily needed. Sometimes if we just go with the largest catchment, it's going to give you what you need to know. But you can see here that it captures a broad swath. This is capturing our community level, so we can look at each of these areas and combine them. In our work, we sampled twice weekly using a 24-hour composite sample. And I apologize for my typoid. This was continuous. So this is data that were collected over 2 years and is continuing with the help of DPH now. So as part of the data collection, once you get the sample, you have to do something with it. So for SARS-CoV-2, this was basically doing a RT-qPCR assay for both the N1 and N2 targets. So our sample was collected. We extracted in at least 6 replicates per sample to get our RNA and then subject it to that RT-qPCR. And we used both of those targets to basically enhance our ability to detect what was there. We also, in our case, used a lot of replicates to offset what would otherwise be a high limit of detection and some stochasticity in terms of how the virus was detected. But everybody who does this work has their own workflow that works for them. The important part is just being able to document what you're doing and making sure you've got process controls so that you can report on efficiency of the assay. In this workflow, you can go from collection to results on the order of hours. So it can be very, very fast and near real time. In terms of the data analysis, sort of the first thing out of the gate is just plotting what we found. So this is a very, it's a messy chart, and it's messy on purpose because the idea is it's showing you all of the data. So this is an example of a time series that went from June 2020 through January of 2023. On the top graph, it shows the viral load. So we're able to take the number of copies of each gene N1 and N2 and then calculate what the 24-hour or daily load is based on the flow into the wastewater treatment plant. And you can see there's just a cloud of data here. It can be anywhere, from non-detect up to 10 million copies per liter. The 2 colors indicate either the N1 or the N2 gene, and then we've got all these different plants. So there's just a lot of data here. The bottom chart shows the reported cases to DPH that we're tracking over time. So this is just the first step. You get the data back, and then you need to look and see what it means. You can pick out general trends here, and we did a lot more statistical analysis to smooth this as we went along, but I wanted to show you the messy version. This is what it looks like when it's in a little clearer. So we start getting into the data interpretation, and you start being able to see trends and being able to understand when you're moving into a spike in terms of cases based on the in this case we were using a lowest smoothing operation. But it's not just looking at our square values and trends. It's also trying to make sense of it. So this is part of the data interpretation. This is just a snippet from when we were hosting a dashboard specifically for Athens, Clarke County. It sort of involved doing our statistical analysis and trying to give the community an idea of what was happening, trying to put it in context. So that data interpretation is really important. And it's also one of the more difficult parts of doing wastewater based surveillance is there's a lot of things that go into this that in real time is sometimes hard to pick out. But as we've had now, years behind us in terms of using this information, so nearly 4 years, the data interpretation is getting a lot better. And then finally, so I guess before I go to data dissemination, this is just part of our interpretation. So this is, looking over time in Athens-Clarke County. The top chart is our COVID-19 cases on a 7-day moving average. The bottom chart shows our SARS-CoV-2 viral load. When we did our analyses on the first year or so of data, they correlate really well. So daily load correlation of 0.7. When we just look at assay positivity, it's 0.82. When we were able to calculate that using wastewater alone could give us a limit of detection of 5 cases per 100,000 and a lead time of up to 6 days. And this is not terribly different from what others have found in other communities using wastewater-based surveillance, specifically for SARS-CoV-2. So now we get into the data dissemination phase. So this specifically, is how you get the information out, and really where this started in terms of the uptick in using wastewater-based surveillance was the idea of using dashboards. So this is a great chart that's been put together by a group at UC Merced called COVID Poops 19, and this is a summary of all of the global SARS-CoV-2 wastewater monitoring efforts that they've been able to pick out for SARS-CoV-2. And you can see it is, it's everywhere. We're highly concentrated in the United States. Europe has a lot of dashboards and monitoring set up, but it is, nearly covering the globe at this point. So this group is tracking 195 separate dashboards. 289 universities in particular have been monitoring their campuses. It's in 72 countries and over 4,500 specific sites. So this is, it's really phenomenal to think about the scale at which this type of surveillance really grew from having, virtually nothing that was long-term in 2020 to this that we have now. And of course, in the US, eh, there we go. The CDC has also, built up this national wastewater surveillance system, which of course all of the participating state public health departments contribute to, and this has really been an amazing thing to see get up and running. So, if you go into this news site, you're able to track at a plant level or at least a county level what's happening in terms of SARS-CoV-2 detection rates and loads. So this is looking at I pulled last night, looking at virus levels by wastewater site across the United States. It's color coded, so you can look. The redder it is, it means that the virus categories are in relatively high levels. As it gets to blues, they're in relatively low levels, at least in terms of their historical trends. You can, again, drill down to individual sites as you go into this. So what the advantage of the CDC news site is that we have this platform for data dissemination that's really powerful. At least it lets the community at large use it. So anybody who's on the internet can get it and see it. I know at the health level, you guys are inputting this data and are able to probably see things at a more granular level. One of the downsides about doing this on a broad scale is you don't get that real-time effect. So the local dashboards can post things very quickly. When you're having to funnel data into higher and higher orders to get it posted onto these dashboards, it's going to be a little bit delayed. So this was pulled last night on March 7th, and you see this is virus waste levels between February 12th and February 26th. So it's lagging a little bit, but it's still giving you really, really important data in terms of what's happening with the SARS-CoV-2 pandemic. And again, data could be posted in hours, but it can sometimes take a little bit longer depending on the level that the dashboard is acting at. So wastewater, we have we have protocols in place for data collection. Data analysis is robust. Data interpretation is getting better as we're going along, as is data dissemination. The link to action is really the critical step in making sure that a surveillance system is doing what it needs to do. And the idea is, and this comes from the CDC news site, is that the link to action is that public health officials will be able to use wastewater data to better understand disease trends in communities, make decisions such as providing guidance on how to prevent infections or increasing testing or vaccination options. And that has always been sort of, the gold standard is how do we get this link to action? And I think this is one of the places that we still haven't quite gotten there. I think most people realize this is a really important tool, but what you do with it, I think is sort of the next step in where we're going. One of the ways, I'll mention 3 ways that this is moving, and this is by no means the end of this. There's certainly a lot more that we could include here. One of the ways this is linking to action is you can take sort of this broad look at what's happening in community and move into targeted sentinel testing, which may make it easier to actually make some decisions or go in and have concrete actions. There's efforts to be able to use wastewater data to actually be sort of the lead in terms of understanding number of cases that we might see in an area. And then, of course, which is relevant to this particular workshop that we're all doing is being able to use sequencing and informatics to sort of fill in what's happening, being able to look at novel variants, discovery for new things that we may not see in clinical cases yet, and working with clinical partners to really understand what's going on. And then one thing that I haven't listed here that is an important part of this whole process is this wastewater surveillance is not limited to just SARS-CoV-2. It's where we started, and it's what has built this platform. But again, I think there's the opportunity to expand in a lot of different ways. And so this is going to be another a big component to look forward to. So if we think of the link to action, so the Sentinel and surveillance, or the Sentinel surveillance component, I think is really important. So the idea here is being able to use the sewer shed to track what's happening. This was used very early on in university campuses back in 2020 when campuses were looking to reopen for the fall 2020 semester. There was lots of universities that actually, as part of their efforts to keep campus safe, or at least to understand what was going on, would set up surveillance that would for specific dorms. So you could back up to a manhole or to some area that was servicing the building and collect samples there so that you could tell if there was any cases or at least a few number of cases in a particular building. That led to concrete action in those cases. And I know universities are very specific types of situations, but in those cases, if a building came up positive, then students in the building could be tested and then isolated, moved to isolation dorms. So the idea was to really be proactive in terms of what was happening in those areas, especially with congregate living, so that you could do contact tracing, you could move people to isolation without having to do it if a particular dorm was not showing up positive. This has also been used in other congregate settings. It's been used in nursing homes. It's been used in prisons. You can imagine, though, as you get closer and closer to identifying individuals, that this is where privacy concerns become important. So this hasn't, you don't see this a lot outside of very specific circumstances. But the idea of using sewer shed tracking could still be important if you're getting into specific neighborhoods or specific areas, if you think that there needs to be some type of intervention. Sort of on the top left here, that's a representation of a hospital. This has been another area of interest. If you're trying to, to capture things that may be new and novel and getting into the population, sometimes that's a very concentrated source of what's happening. So you can go up closer to a sewer shed line that's near a hospital. Another area where Sentinel surveillance is potentially very powerful is looking at ports of entry and spillover threats. This is particularly when you're thinking about new things, that you don't want moving. So there's been some very really exciting work that's been done in airports. So the idea is you're essentially looking at the way especially international flights land, doing analysis of sewage on those international flights. The idea is to turn those over quickly and have an idea of what's coming in to a country. You could also do that on cruise ships. Anywhere you've got potential entry that you want to be able to monitor without having to monitor all of the people coming in. The spillover threats is also potentially powerful when you're looking to identify new threats. Of course, a lot of our pandemics and new diseases have come from spillover from animals, including SARS-CoV-2. So areas where you have concentrated animal feed operations, CAFOs, other areas of animal waste, or areas where you're concerned about spillover threats. Using the term wastewater is not necessarily appropriate here. In some cases, there's waste lagoons associated with these animals, and sometimes it would just be environmental sampling from these animals as well. But this is another place where you could be really targeted in terms of your surveillance to try to better understand what's going on, and also offer the opportunity for interventions at those more narrowly defined areas. And then again, as sort of using wastewater as a primary data source. So there's early modeling work that's been done. If you look at our actual, this is from Athens again as well. The blue line here shows our actual cases in terms of a 7-day moving average. The pink line shows prediction using a very simple linear model. And again, these things aren't perfect, but you can start to see that they're trending well together. So at some point, as we have fewer and fewer people coming in to get tested, can we use assay positivity or viral load as a way of estimating what cases are in a community? And then finally, the idea of sequencing. So when we look at wastewater, not only do we have an idea of viral load, we can also get into the weeds in terms of what's actually there. So this is the idea of using wastewater informatics. Some of the first work on sequencing and looking for variants within wastewater was early in 2020 in Montana. And so it was a very nice proof of concept that you could go into wastewater and start pulling out variants, and so not only seeing what was happening, in terms of the overall epidemic at the time, but actually the variants that were causing it and when things were moving in and out. And that's where you can start getting into some very interesting dynamics to understand transmission dynamics a little bit more. And it can also be used for discovery. So this, again, it can also, in addition to discovery, it can cover some gaps in clinical sequencing. So if we look at an epidemic curve from Athens, Georgia, again, from January 2021 to January of 2022, where we capture the Delta wave there in the middle, and then the first Omicron wave there on the right. Most of these bars are gray. The little colored part of the bars that you can see here, those are the clinical samples that were sequenced. So that's where we can see the waves come in. So the blue shows the Delta, the light green shows the Omicron, but you can see we're missing as many sequences as we have, and we do have a lot of clinical sequences. We're still missing a lot of them. There are things that we could be missing in terms of our surveillance, excuse me. This is where wastewater surveillance and wastewater informatics can start filling in that gap. It can start telling us if we've got new things that are perhaps coming up in that gray bar that we're missing altogether. It can give us a snapshot in time. So it can really give us an idea of the distribution of variants and the distribution of different strain types in a single sample, rather than having to rely on individual clinical samples. And I thought this was a really nice chart that sort of goes over how working with clinical labs as well as wastewater surveillance really can work together, especially as we start looking at genomic surveillance. And this was work that's been done in Kentucky. And so we can sort of, start at the top here. This is community level wastewater sampling genomic sequences. So you have geographically resolved wastewater samples. Again, we know what a sewer shed looks like. We know the community that it's collecting from. So in addition to collecting data just on what's there, you can start doing genomic analysis. That can lead to detection. Perhaps a wastewater sample will reveal some particular variant. That may trigger a public health lab to increase the number of clinical tests for sequencing in a geographic area. It may indicate that there's something new coming, so that would trigger an action on the health department or the health lab. This would then we would have clinical PCR swabs that are tested positive that could be then confirmed in terms of variant presence or other variants that may be present as well. When those are detected, that would indicate that we've got, something going on. It's detected in the wastewater, then it's detected in your clinical sample. Sometimes a clinical sample might reveal something interesting that indicates maybe we've got a broader problem. Then you can go to the wastewater samples and see if that's happening on a population level. And I think this is kind of the idea of how all of this should work together is the wastewater should be informing public health departments in terms of what might be going on, and anything from the clinical data should be informing what we're looking for in the wastewater to make sure we're not missing something. And I think this is a very nice way of sort of showing how those things work together, and is a really good example of that link to action that we need to have in to have a good surveillance method. So I will finish up in the next couple of minutes, but I just kind of wanted to go through, this was like a CDC 101 with surveillance, the attribute of a surveillance system that it should have, what questions it should answer. And then I sort of wanted to add here, like how wastewater surveillance fits into that. So of course, a surveillance system needs to be useful. How useful is the system in accomplishing its objectives? So for wastewater surveillance, you need to be very clear about what the objectives are. It's not going to be to identify a case for isolation. It is going to be what's happening on a population level, but it has proven to be very good for tracking trends and discovery. The data quality, how reliable are the available data? How complete is it? How accurate is it? This is something that's improving as we have more and more labs working on wastewater surveillance, as we have organizations like National Wastewater Surveillance System coming into place. We're getting better and better at making sure that the data are can be shared across geographic areas and across labs in a way that's helpful and comparable. Timeliness, how quickly are reports received? I think this is one of the big advantages of wastewater surveillance, is it can be very, very rapid. Flexibility. Again, this is another advantage. These are just, PCR targets for the most part. So you can update an assay, pretty quickly depending on what you're looking for. So it's very adaptable and very flexible. And then simplicity. This is simple. This is getting a sample from a wastewater treatment plant that's already collecting these samples anyway, and then setting up your assays. I don't want to oversimplify it. There's things you need to do in the lab. There's things to take into account in terms of a wastewater sample, but it's a relatively straightforward process. It's stable, the surveillance system. How well does it work? Does it break down often? This is kind of potentially have unlimited sample collection here. You can have breakdowns for a lot of different reasons in the lab and otherwise, but those are something that happens in a lab in general. But in terms of the wastewater process, these things are running all the time. So it's a reliable place and a stable place to get samples. Sensitivity is an issue, and I think how well does it capture the intended cases? And there's a sensitivity question here. Are we capturing cases? Are we capturing load? Or are we just looking for detection? So that requires, a decision on what the endpoint is. But we know, at least, I'll give our example in Athens. We can detect about 5 reported cases per 100,000. Other places may have different thresholds, but it is a sensitive metric, at least for SARS-CoV-2. The positive predictive value, again, this is where it gets a little wishy-washy, because we're trying to predict cases, but that's an area that needs more work and more modeling. It's very, very representative. Again, you don't have to worry about testing a lot of individuals. You are getting the entire population. So again, that's one of the big strengths for a wastewater surveillance system. And then acceptability, and I kind of went here, like how easy is the system's operation? One of the ways that it makes it particularly attractive, again, it's anonymous. You don't have to have buy-in. People are contributing because they're using their toilets and they're using showers and they're using their sinks. So even though I think that wastewater has a really important place in terms of our surveillance systems, it does have some limitations. So as we start with people that are shedding the virus, up here on the top left, that goes into the sewage conveyance lines. It then gets processed in the lab, and then we estimate a concentration. When you've got these, to get into the sewage conveyance system, it may vary depending on your population. Sometimes your sample is going to be diluted by industrial inputs. Sometimes it's diluted because it rains and you have leaky sewer lines. So it's not perfect. It's not that everything in that sewer is coming just from humans. There's other things that are going on there as well. Again, we've got infiltration and intrusion from wet weather. The virus can decay, so depending how long it's taking, how far it's moving through that treatment line or that conveyance line, you're going to lose some virus. When you get to the lab, of course, there could be any of number of things that happens when you get to a lab. Processing delays, supply chain issues. You don't have pipette tips, pipetting error. So all that's going to, these are the things that go into remembering, the imperfections in the system. The viral decay is particularly interesting when we're looking at sequencing as well. Some of the things we've seen in our lab is, when the virus gets degraded, it can be more difficult to identify specific genomic sequences. So that viral decay component can also be important at the next steps. So this is one of my next to the last, I think it's my next to the last slide. This is based on a recent National Academy of Science workshop that's been really trying to look at how the best practices for wastewater surveillance. And these are sort of the top points that they came up with that I think it's important to sort of highlight here. To have an effective wastewater surveillance system, it needs to be flexible. So it's got to go beyond SARS-CoV-2 and be able to track multiple pathogens simultaneously and pivot quickly. It should be equitable. It should be work across population demographics. It should engage underrepresented communities and extrapolate findings to unsewered communities. I think the last point is the more difficult one. It is hard to do this in rural areas that don't have centralized sewage. So that's one of the places where this is a limitation in terms of equitability. Integration. So there should be coordination and collaboration across multiple partners. So this is with the utilities that are collecting the samples or, working on the wastewater treatment plant itself, the laboratories that are doing the processing, and then the public health agencies that actually need to do something with those data. You need to triangulate data from different surveillance systems. So that sort of goes back to one of the slides about really these things need to work together to be effective. It can't just be wastewater on its own. And we have to ensure effective data interpretation so that it helps with decision making and it isn't just a surveillance system that we're putting out there and we can't do anything with. It needs to be actionable. So again, this goes back to the last bullet. It has to inform decisions about clinical and public health resource allocations and policy. It has to be timely, available, reliable, representative, and interpretable. We have to be able to do something with it or it will be useless. And then finally, it has to be fiscally and operationally sustainable. This means it needs to keep going. In order to really be effective, this needs to be something that we know that we can rely on, that's going to be available, that we can build on. It can't just be, a snapshot in time and it's done. So to wrap up, I'll just make a case for the role for wastewater-based surveillance. When does it make sense? So it can assess trends in an entire community at one time. It essentially pools thousands to millions of people. It can track asymptomatic spread, especially if can be really important if it's asymptomatic spread is important in transmission. It can be really important when mass or repeated testing is simply not feasible, and it's a really nice complement to traditional surveillance and diagnostic testing. As we get sort of more into discovery and using new pathogens, it can be used to note impending outbreaks, impending surges in the case of SARS-CoV-2, or something new that we may not have captured in clinical data yet. It can be used to monitor the effectiveness of interventions. So this is like the case of polio, where you do have a vaccine that should stop transmission. It can be really helpful to see if you're getting a handle on that. And I think one of the really important things about wastewater-based surveillance is it's not biased by individuals' behavior. They do not have to go seek a test. They do not have to go somewhere. They're contributing to the sample by living and working in their homes and offices. So I'll take questions. I just wanted to sort of put a heads up for what's coming. So next week, we're really happy to have Marlene Wolf speaking from Emory University. So she runs the wastewater scan, which is looking at a lot of different pathogens nationally. I think she'll bring some really interesting information that sort of broadens what we can do with wastewater-based surveillance. And then in 2 weeks, on March 22nd, we've got shorter talks by two PhD students at the University of Georgia that are working a lot more on the sequencing component and can get into some more details about how we're using that. And then Christina Meza and Stephen Woods, who have been on the ground ramping up all of the efforts across Georgia in terms of wastewater surveillance. So I will try to exit out of this now and happy to take questions.